Perfect. All righty. So thank you all for joining us for the July session of Being a Woman Breast Cancer Support Group, which is sponsored by UF Health Cancer Center. Tonight, we have a very, very, very special guest. I am so excited to introduce Ms. Travell Cooper McKyer. Travell is correct me if I'm wrong, the regional coordinator for Broward and Martin counties for the Florida Department of Health in Broward County. And we at the Beautiful Gate work very, very closely with Travell and all of the regional coordinators with our MASS program. So I'm going to stop it there and I'm going to let Travell share how we work with her and her colleagues.
Well, I am super happy to explain that because um, the MASS project has been very instrumental in helping to promote the program and to provide information and education to women, specifically when it started in the South Florida area. So from that, the word got out to women whom we weren't able to reach about the breast and cervical cancer program. So um, I would think it's been going about 5, 6 years, Pamela.
About the MASS
A
program,
MASS project when it first started,
2015.
2015. So way longer. That's 10 years.
Yes.
So it's been an amazing journey, and we've seen it grown, from just going from 1 or 2 counties to now basically statewide. And
hmm
and now I'm hearing it may be international. So never know. But what I like is about it is that the MASS project is, comes to um, the audience on a personal level. And, it's within that project, the history and the background of someone, Pamela, who didn't really know what was actually happening to her. And so I think people can relate to that because not all of us know, you know, when breast cancer hit, what's going on. So I just think that on that personal level, it helps. And then it also draws people to trust more and to be able to, reach out and feel like it's okay to get a screening, which is the whole purpose of the breast and cervical cancer program. So you're
You okay?
I'm sorry, I had myself muted. I'm sure my mother would have liked me to stay muted more as a child. Ha ha.
So, so tell them how this program came to be in existence.
well, it's interesting um to me, and I like hearing historical kinds of things, but it really all started before 1990 when a congressman from a United States congressman, Henry Waxman from California, did some research, went through different states and talked to different people about breast and cervical cancer deaths, and found that women who were uninsured or who didn't have funding, were dying more from breast and cervical cancer. So he came up with all the necessary statistics and information and presented it to our United States Congress. And what I really like about it is that Congress was on board, because if we all know how long it takes for a bill to be introduced and then become a law, it could take years, or it could go into committee and it could die. But when Henry Waxman brought this bill to our United States Congress, in 3 months, it became a law. And so what happened after that, all the states could participate including Indian tribes or Native American tribe, the territories could also participate in it as well. And what the United States Congress did was sign this over to the Centers for Disease Control and Prevention and told them to kind of set up the infrastructure. And once they set the infrastructure up, then they submitted a proposal to all the states and the tribes and the territories to apply to become a part of the National Breast and Cervical Cancer Early Detection Program. And from there, they set up like the structure of how this was going to work. And what I guess I like is that for the first 10 years from 1990,
Mhm.
for 10 years, they just focused on getting the word out, information, talking about why it's important, making sure people knew about it. And the screening numbers at that point was very, very low because, again, people had to know that this program existed. And then the next 10 years was basically focused on quality. And so, Pam, I know when you were involved with the program, we talked about, the indicators, we wanted to make sure that ladies, when they got their mammogram and they received an abnormal, that they got their results in a timely manner. So CDC set indicators for everybody who applied to be a part of the program and screened a lady for a breast or cervical cancer, and that woman had an abnormal result, that they got their result in a timely manner. And so if we, as a program, did not meet those indicators, there was a penalty. So,
Mm.
yeah. So,
Mm.
and sometimes it's a financial penalty. So
That's where that 90 days come in, huh?
it's 60 days.
Oh, 60 days.
60 days, right. So, in order for us to make sure that ladies enrolled in the program understood that, we kind of put it on our flyers and we, made sure they understood that if you're going to come into the program and receive a free mammogram or a free pap test or a low cost one, then you have to know that if it's abnormal, then you have to be available so that we can make the appointment. We'll pay for it, but you have to be available. So, but let me back up. Um, when CDC set up, or the Centers for Disease Control and Prevention set up the infrastructure for this program, one of the things they said was that it had to be for either a free or low cost screening mammogram. So if a woman came to the program and they needed a biopsy, they had already had a screening mammogram, already had an ultrasound, they were not eligible for this program.
And why is that?
It's because the way CDC set it up, it was for screenings. And a screening versus diagnostics are very different. So if they already had a biopsy, or if they needed a biopsy, they already had a mammogram, they were not eligible for this program. So they had to, number one, there could be several reasons, and I'm just going to guess on this one. Because there's limited funding, we cannot, or the program didn't start off just saying we'll pay for everybody's biopsy after you do your own mammogram. It wanted to make sure they had the funding to treat the ladies who enrolled from the mammogram. Because if we expended all the funding to people who just needed a biopsy, then we wouldn't have the funding for just a regular screening mammogram or a pap test. And this program is a screening program. That's the name. Um, so that's probably the main reason that it was only available to the women who are actually enrolled in the program.
And that's a huge benefit
Mm-hmm.
to have the diagnostic covered, because I remember when I had to go for a diagnostic earlier this year, I got a probably about 6 weeks later, I got a $600 present in the mail.
Oh, wow.
And we have insurance. I won't say who we're insured with, but that was my diagnostic mammogram, which was not fully covered. So that is a huge benefit.
Right. Absolutely.
Okay, with what Terry just said, uh, now the program has changed a little, right?
Mhm.
There are some exceptions to the rule, right?
Yes. So the
Some you
exception
do have
is
some discretions,
only by age. So say we have a 20-year-old that call us and they have a breast lump. So a 20-year-old wouldn't get a mammogram
right?
necessarily because different medical reasons, and also because of the anatomy of the breast itself. So then that clinician would probably write a prescription for an ultrasound, a breast ultrasound,
Mm-hmm.
which is a diagnostic tool. So that's
Right.
the exception that if based off age, that woman cannot have, or that person cannot have a screening mammogram, that they need to go straight to diagnostics, then that's the case. Another way is, say you're 50 years old and you palpate a breast lump and your doctor palpate a breast lump. The doctor's not going to order a screening mammogram because a screening mammogram only takes limited views of the breast. A diagnostic mammogram takes more views of the breast, and and then you're able to do an ultrasound because again, a breast lump on a mammogram, we may show the shape or maybe a shape of a lump, but an ultrasound would look into the lump and to see if it's a solid or cyst. So now we're past screening. But this may be that woman's first mammogram, but because she has a breast condition, then we will not do a screening mammogram, but a diagnostic. But in our term, it is still the first level and it's still considered a screening, except now the procedure used is a diagnostic tool. That may be a little confusing, but it's still screening and they're starting with us, right? They didn't have a screening mammogram somewhere else and then decided to come to us for the ultrasound.
Mhm.
Everything
Okay.
started within the program. This would be their initial services to with us.
Well, why would that 20-year-old uh qualify for a program that's for 40 to 64-year-old?
Okay, good question. And that's the discretion that the Florida, I'm not sure if all states do this. I can only speak for the state of Florida. We are allowed to screen women under the age of 40 if they have a current breast condition. So we've had guidance counselors call us from high schools where a high school teenager felt a lump. And knowing historically that we have teenagers that have been diagnosed with breast cancer.
Mm-hmm.
So it's not a bad thing that we say, let's bring them in and let's, do a check to see what's going on. But again, that teenager probably would not get a mammogram unless the doctor orders it. They would probably go straight to an ultrasound. And so that would be their screening. They would have a clinical breast exam, probably by their own doctor, just to make sure that, a lump at that age could be hormonal or could
Right.
be something that's concerning. So it's up to the doctor at that point to determine whether or not they want to write the prescription because a ultrasound requires a doctor's prescription. That means the doctor has agreed that there is a concern and that they now want um, that patient or that woman to have a screening or in this case an ultrasound if you're talking about a teenager.
You know, we provide information to women all over the country about where they can go and get their screening done. And that information is easy for me because I know where to send them.
Mm-hmm.
And since we launched an commercial, well, how long ago was that, Terry? Maybe about 2 months
About
ago.
two and a half months ago.
And we've gotten women from at least now it's 20 states from that commercial. 20 states.
Nice.
And when I contact each one of them by email, and I let them know, I created a template and let them know, and I just plug in their state and their information. Now, I know when you say Florida had, guidelines are different, but I noticed that their guidelines are different as well.
Mm,
Because let's say Atlanta will see you at their guidelines in Georgia is 34. 30,
oh,
yes, 34. That's their guideline. Like you have 40 to 64, they have 34. And I said, and that made me curious. Why 34? So now I wanted to know what goes on in that community. What's going on in that community where your guidelines are 34 years old. So, but I'm not an epidemiologist, but I'm curious about those type of things, because I've been working with a lot of scientists, when it comes to breast cancer, like at University of Miami. They the one that piqued my interest. So, but in other states, their guidelines they varies. They will see teenagers, but that's not the normal guideline. But it's still they say that we will see them if they have first degree relatives, something like that, and uninsured. So the guidelines are different, but the program is still the same. I, you
uh,
know, it's still the same, and that's what I like about this program. So, when it comes to this program, if you're in this program, what do what do the women have to look forward to, just from a screening mammogram? What else is available to them if something else needs to be, they need additional screenings, and God forbid, and they get and they're diagnosed. What happens to that woman? Take us there from the time
okay.
from the screening. Let's say screening, and there was an abnormal, and then there was something else. Take us from that point all the way to treatment.
Okay. Well, let's
And wait a
start
minute,
with
I'm
the
sorry.
uh,
From that point to treatment and your role as far as the breast and cervical cancer role, from the point of uh, screening to treatment.
okay. Well, let's give ourselves this is a 40-year-old who felt a lump and felt a lump only in, one side of her body in her breast. So they give us a call and we'll, ask what's going on. And within our program, we have about 28 providers across the two counties in Broward County and in Martin County. And so we would look to see where they live and try to get them scheduled at the closest site to them, right? So once they come into our program, if they don't have their own doctor, then we will assign them to one of our providers. Again, one that's closest to their area. If they have their own doctor and they already have a prescription, then we'll just need that prescription that says, say, I have a breast lump and now I need this procedure. So what we do then, we make sure that the doctor has, this may sound um, medical, but because we know that if a person has a breast lump, they do not get a screening mammogram.
Right.
Okay. If they have a breast lump, at the very least, they need to get a diagnostic mammogram and an ultrasound. So we've had on occasions where, some doctors just schedule a screening mammogram. So we tell that patient to go back to their doctor and explain that maybe they didn't know that now you have a breast lump that you feel, and the prescription should be changed to, that fits what fits the tool to determine what's going on with that breast lump. So once they get the prescription and they come back to us, then we will schedule them at one of our sites, at one of the hospitals, and one of the imaging sites, so that they can get, in this case, a diagnostic mammogram and an ultrasound. So say that ultrasound comes back and they say that it's not a cyst, it's solid. And now we need to find out, is it the solid a benign or a malignant solid?
Mm-hmm.
Is it cells or is it something else like a fibroadenoma? So then we now issue an authorization. She goes back to her doctor and she gets a prescription for that. Again, in any case, the doctor has to write the prescription. We are not medical. We're educators and we're coordinators, but we're not medical right now. So those prescriptions will have to come from their doctor or one of our providers. All right. And again, if the provider is one of ours, that patient still is not paying for anything at this point. We're paying for the diagnostic mammogram. We're also paying for that ultrasound. So now if there's a lump and it needs further diagnosing, like an ultrasound guided biopsy or stereotactic biopsy, our program also funds that as well. So
Mm-hmm.
the patient just only needs to get the prescription. Or again, if they don't have one, we'll send them to one of our doctors. So the next step is that the we'll get them scheduled for the next procedure, which in this case could be a biopsy. And again, it's no cost to the patient at all. So the patient then will get the biopsy, and now we wait for the pathology report. If that pathology report comes back and it is a cancer, then it is our role to make sure that that patient gets into treatment. So there's two kinds of patient. There's one that has been a U.S. citizen, forever, at least 5 years or more. There is one that hasn't been a U.S. citizen for 5 years or more. Maybe they've been a U.S. citizen for 4 years. And there could be some that's not even a U.S. citizen. But let's talk about the ones who are U.S. citizens and they have been a U.S. citizen for 5 years or more. In the year 2000, President Clinton signed into law that allowed the states to use their Medicaid specifically for this program, specifically
Mm-hmm.
for women who enrolled in this program and received a cancer diagnosis through this program. They are now eligible to apply for Medicaid. And so now the Medicaid will provide the funding needed for that patient to get treatment at any facility that takes Medicaid. That patient will get straight Medicaid. And they will have that Medicaid for as long as they are in treatment. Like we have some ladies who, after the cancer is removed, that they have to go on an anti-cancer medication. And sometimes that medication is 5 years or more. Scientists and statistics are showing that women have to be on it longer now. But in the beginning, and we could go over that, but in the beginning, it's up to 5 years. But Medicaid will still be in effect for them as long as their doctors say that they're in treatment. So, and the anti-cancer medication is a part of the treatment. So they can be on Medicaid for 5 years or more. But we're hearing now statistically that it may be of value for some women to be on the anti-cancer meds longer. Now, I'm not sure which one. I don't know the names. I don't know any of that. But that's what I've heard recently, that some patients can be on the anti-cancer meds for more. So that means that they can have the Medicaid for even longer. So Now let's talk about the woman who is a U.S. citizen but has only been a U.S. citizen for under 5 years. It is still our job. It is still our role to make sure that that woman gets into treatment. And so what we do is we try to work with our local providers, local resources. In this case, sometimes it could be, out of the county that they may have to travel a little further for services. But in the Broward County area, we do have two tax assisted hospitals
Mm.
that can assist, and we also have a private hospital that has a charity fund that can assist. So we've always gotten our patients into treatment, regardless of their legal status.
Okay, well, having the I'm not quite sure whether the hospital is private or uh, but they have a catchment area. Haven't they start? They have catchment areas. If you live within that catchment area, and I think what was Holy Cross?
Mm-hmm.
Holy Cross used to take women from all over, but then they created a catchment area, and so now that has reduced the women who they can see, right?
Well, I can't speak to that, but I do know for the tax assisted hospitals, there is a catchment area. So, you know, it's divided, the county is divided. So you have the South Broward and you have the North Broward. Now in Martin County, there is no such tax assisted hospital. Remember, our program covers two counties,
Right.
or in Martin counties. And there is no tax assisted hospital in Martin County. So our ladies who are diagnosed there may have to travel out of county to some place that will assist them.
Oh, okay. All right.
Right. But again, all of our patients who have been diagnosed, we go to go to bat for them to make sure that they get into treatment. And so far, we haven't had any woman that diagnosed that did not get into treatment.
I don't want to take up all the court because this is like talking about the Bible to me because I love this program and I really do, and so I learn more and more. But anyone that has questions, family members, please go ahead.
Mhm. And I do have a question. Travell, you mentioned that for women who have been U.S. citizens for less than 5 years, that you all do work with the hospitals to try to, to get them into the program and get seen. Is that on a national level as well? Does the national program work with women and I guess men as well, correct?
Well,
Who are
not well,
showing symptoms or nationally if they've been US citizens 4 years,
right.
under
So
5 years.
according to, remember I talked about the bill that became a law. So according to that, it's for women only. This program is for women only. And in terms of what they do for those that are undocumented or haven't been a US citizen for at least 5 years, um, it it really is up to that state. But the law states that we have to nationwide make sure that the women get into treatment. So whatever resources they have in their state or what's going on, of course, I may not know all of that, but it's a court. Our rule states that we have to make sure they get into treatment.
Okay. And
And we
okay.
have to make sure they get into treatment within 60 days. That's the indicators that came out in those second 10 years of the National Breast and Cervical Cancer Program.
Okay. Perfect. Thank you for that clarification.
But I have to applaud, basically our Congress and for, looking at that. It, it, I guess I say it's just fiscally beneficial to have this kind of a program, because if you think about it, women who did not have this kind of program would then have to work with other kind of resources, take up tax dollars, or I'm not sure where the funding would come from, or they wouldn't get any services at all, and then they would die, from a cancer not being treated. So I think that the breast and cervical cancer program is a good use of our federal dollars. Um, and it's just amazing how it could work for everybody, not just from the perspective of making sure women get the needed treatment, but also I think it's a fiscally sound program. And I'm happy that, I know that I'm not sure what's happening this year, but in the past, like the funding to the National Breast and Cervical Cancer Program from our Congress has increased. So we're hoping that they continue to fund it. And we're hoping that women will definitely have a benefit to this program.
Hello. So I have a question. Regarding the screening, is age the only criteria for being accepted into the program? I'm asking this because, for instance, there are women, for instance, that have historical family history, let's say, or what if they don't have any symptom and they just want to do a check? Are they also integrated into the program?
Good question. So women in our area, in the state of Florida, it's women age 40 and older who don't have to have symptoms. They could just be, eligible based off their age. So age 40 and older, they can get a mammogram. So we also provide pap tests, but now with the guidelines for the state of Florida, you have to be at least 50 years of age in order to get a pap test. Now, last year we lowered the age during the last part of the year to age 40, but I'm not sure what it's going to be right now. We haven't decided what that's going to be right now, but the normal age for a pap test in our program is age 50. But we all know the starting age for a pap test is actually age 21. So, but this program will fund it for women age 50 and older. And the other criteria is that they have to meet income guidelines. So what CDC set up is that women have to be at least the household income 200% of the federal poverty level. So for one person from last year, they could make up to $30,000 a year. For a family of two, around a little more than $40,000 a year. And so it just goes up based off family size. But you have to meet the income guidelines as well for the program. And then the last criteria for us, they have to be a resident of the state of Florida. If you're visiting, then you're not eligible. And because you have to live here in the state of Florida. So the state of Florida don't provide the services to visitors, but only to residents of the state of Florida. So those are the three things. They have to be of age, have to meet the income guidelines, and have to live here in the state of Florida. And in our area, we've added one more thing, and that is they have to be available for the next 60 days. So that if there is an abnormal, we need to make sure that they're available to go and get their follow-up tested. Again, we pay for it, but they need to be available to get that diagnostic test. Hopefully that answers your question.
Sure. Thank you very much.
Travell,
Yes.
this is Jerry Francor. How are you?
Oh, there's a gnat in my office, so I apologize for that.
Hi, Pam. Hi, Terry. I was wondering because I've been following the BSEP program, and with Congress cutting it so dramatically, And last I heard, the state of Florida, where we had got it matching, and we worked so hard to get matching funding, that they cut that this year as well. Is that?
I haven't heard that, Jerry. As a matter of fact, the last meeting that I was on with our state office is that it was actually increased. And you guys did work, the advocates did work very, very hard. Last year we got 1.2 million over the normal 300,000 that we, that we
Yeah.
normally get. But we got the 1.2 million last year, and I understand this year, and I don't have my notes in front of me, but it's definitely more than 1.2. I don't know that that budget's been signed. I don't know any of that part, but I did hear that it was increased this year as opposed to cut. Now I don't know what
Okay.
happened on the CDC level. I don't know about that at all.
Okay, because I got because I get emails from what's going on up there anyway because of what I do. But no, I got an alert out saying, but I haven't heard any more since that. And Rita had told me that as well. So I wasn't. That's why I was wondering if you had heard anything different.
Yeah. No, I haven't. And again, I haven't received any information about funding cuts to the program.
Okay. I don't want it cut.
No, none
Nobody
of us
does.
do.
It's a great program.
None of us do. None of us do.
We worked hard to get that first 300,000.
Absolutely. Absolutely. So, and honestly, we appreciate all the hard work that the advocates do, on behalf of the breast and cervical cancer program. Because as I said, this is it's the best use of our federal dollars. It's wonderful and it helps so many people. Um, what we're needing right now is again to get the word out more about the availability of the program. And I know we have events coming up, and the Mass Project helps quite a bit with advertising for us. And we need to make sure that ladies understand that this program is available. And I was talking about the first 10 years and the second 10 years. I didn't get around to the third um, 10 years, which is basically now that the emphasis is on reaching out to the ladies who actually really, really need this program. And so CDC now emphasizes education, emphasize patient navigation, the aggressive outreach, and trying to connect to populations that really need the screening services. And so that's why I'm kind of happy that there's some more, um, um, I guess, entities that are popping up to help with that, like the Math Project, to help with educating and to help with providing information about this program. And last year we actually saw an increase in the numbers of um, women interested in our program. So
Thank
far,
you very much.
so so much so that we had to actually end the screenings because we had reached capacity and we had basically run out of money for that year. And we were directing ladies to come back in July when a new budget comes up. So, and again, we're not seeing so much of a lot of women enrolled in a program this last year, actually since COVID. So we're needing women now to understand this program is available. We need them to come out and take care of their health and not to be afraid to, get services. So
I
Well,
have
let me know what I can do because I've got plenty of contacts at UF, at Moffitt, other places throughout the state. So I will go to see them if you want me to.
well, that helps the whole state, when everybody advocates on behalf of the program. We need the state numbers to increase. We need the not just in a particular area, but statewide. So whatever anybody
Mhm.
can do statewide to, like this podcast, to make sure that women are aware of this program and can take advantage of it.
Travell, I have two quick questions. Um, you address women who were uninsured. Does the program offer any benefits for women who may be right at that max income level, but may be underinsured?
Mm.
That's the first question. And the second question is, because in this third 10-year segment, they want us to try to, promote it as much as possible. Does the national program provide the states any type of national marketing resources
Oh,
to help promote it within the states?
well, so I've been with the program over 24 years. So we'll start with that. And when I first started, the state of Florida had an educational budget in which they would be able to do billboards or do television commercials, things of that nature. Lately, I haven't seen that. So I'm not sure. Again, I am not privy to, what's been allocated, what the budget is, but most of our um, uh, educational or promotional items are in the form of flyers or palm cards or at one point we even had an 800 number so
Mhm.
that anyone across the state could call. So now what they do, they will call the state office, and the state office then will channel that call towards whatever region. There are 18 regions in the state of Florida. So our region is just one of them. So in terms of marketing and advertising, I don't know. I can't speak to that, what, has been allocated for that. So I just know what was done in the past, and I'm not sure what changed. But I do know that in the past, the marketing, again, kind of fell in line with what CDC said about making sure the word got out.
Mhm.
And then the second 10 years was based on quality. That's when we got our indicators. Women need to complete services within a certain amount of time frame. And now this last set of 10 years is based off making sure we reach out to the women who really need our services. So maybe when I first started, budget was there for marketing because that was the mission of CDC at that time. Now it's basically let's get to the ladies who really need the services.
Okay.
That answers that question. You asked
That
what was
does.
the first question again?
Women that may be
Oh,
underinsured, are they eligible for the program?
so if they don't fall at or within 200% of the federal poverty level, then there is nothing that we can do to provide any additional help or funding, like if their insurance is like at the max or any of those things. But I do know that there's some hospitals that will assist sometimes with either the cash rate. I know sometimes we would tell ladies if they are over income for our program or if they have insurance with a high deductible, then to talk with the billing department at the hospitals and to see what could be done. But as far as this program, the rules are set in stone. If they fall outside of the 200% of the federal poverty level, then we can't assist.
Okay. And then for women who are living outside of the state of Florida, because like Miss Pam said, when we ran that streaming commercial about 2.5 months ago, we only ran it on multiple streaming platforms in the state of Florida. But of course, people travel, they log in to their streaming account, and we've gotten so many women from across the United States. So how would someone watching this video at a later date find this program in their state?
Awesome question. So according to the way the rules were set up, with the way CDC set the rules up, this program is operated out of all county health departments. So we are tasked in the state of Florida to cover every county. All right. And so the states outside of Florida are also tasked with that. They have to cover every county. So I would say to that person who's outside of the state of Florida, contact their local county health department or Department of Health and find out where their local breast and cervical cancer program is. So we're regionalized, so we cover 2 counties. And so I'm not sure how the other states operate. They may be regionalized as well. So maybe they may have a lead county that covers, several other counties. But at any rate, they should be able to contact the state office in their state. So I know you're in Georgia, so maybe the state health department will be able to assist. That's how our state works. If someone moves here and now they need services, they don't know where to go, they can call our state Department of Health, and we will get the information if they lived in, say, Broward County. And we would get the information from our state office about how to contact that patient to get services. So I am sure that it probably works the same way in the other states as well.
Okay.
It can be a little bit different in the other states since I work throughout the U.S. One thing I wanted to ask is, in Florida, do you still have to go to the designated people to get your mammograms done? Because in the majority of the states, you can go anywhere you want to get the mammograms, but in Florida, we can't. We're trying to get that changed.
Well, no, we can go wherever we get a contract. So it's up to each region. Remember, I said we have 18 regions. So in my region, if there's a hospital that wants to participate in this program, then we enter into a contract. So the contract is to protect the patient. So we talk about money. One of the things that's wonderful about this is that this program doesn't necessarily pay full market rate for a mammogram. So, but the hospital or whoever we contract with has to agree to accept that payment that's set by CDC. So I'm going to do something arbitrary. So say the market rate for a mammogram is $10. Okay, we know that's not true, right? So say the market rate is $10. Well, maybe our program, if we contract with them, agree that we're only going to pay you $8. So that means we could help more ladies based off getting a lower rate. And that rate is set, again, not by us. So if the hospital agrees to partner with us and to take that rate and to go into contract and to say, you're going to take that rate and you're not going to balance bill our patient, you're not going to bill our patient that extra $2, then that's how it works. It's not that they can't go somewhere else. It's just that hospital or that entity has to agree with how we're going to protect our patients so that they don't get billed for services that we say are free. So I'm not sure how it works in other states, but in the state of Florida, we want to protect our patients. We want to make sure that the hospitals or whatever entity don't try to collect from them once we pay the bill.
Let me I want to ask this. I know the time is winding down, and I have so enjoyed this. I'm learning more and more about a program that I already love. I love this program. You know that. I love it. And I think everybody at the Florida Department of Health knows that I love this program. They do.
Yes.
How are your providers selected? Now I'm going to leave that be our question. And because I know we got just a few minutes, but I just explain to them how your providers are selected.
Well, there's two kinds of providers. So they're the providers who are like the doctor's offices. They write the prescriptions. They monitor that patient, through every step of the way in terms of ultrasound, biopsy, or whatever. They're there for them. Then there's the other provider that just provides the service. They just do the mammogram. They just do the ultrasound. They just do the biopsy. And they don't really have any follow-up with that patient, within the program. So we call them, one is a screening site in our area, and one is a provider site. Okay. So a screening site is based off, do you have capacity? Basically, do you have a nice office? Because we don't want our patients, just because they can't pay, to go to some place that's not presentable. So then also, what's the credentials of the people that work there, or the doctors? And we look at all of that, and then we say, now, are you willing to follow up with our patients? Are you willing to make sure they get the services that they need within a certain amount of time frame? Are you going to be able to talk with them respectfully, give them all the information they need, to get the next step? So that's our screening site. And as far as our provider sites, I once had a conversation with a doctor that said to me, make sure your provider site that does the mammograms can do more than just a mammogram, can do, an ultrasound or a biopsy or MRI, that they're a full service site, because we don't want our patients jumping from place to place. And we want to make sure that when they go to this place to get a mammogram, that they could also get the next step if they need to. So again, hospitals anyway have to be credentialed. They have to have the right licensure. So we don't really have to check so much into that. If they have the right credentials and they submit it to our state of Florida, then we trust that they're legal and everything is fine. So basically, we want to make sure that they're eligible to that they have the right equipment, that they also are able to do more than just a mammogram for our patients. So I like to make sure that when we contract with somebody, that they meet all those standards. The screening sites are going to be able to do our what's necessary to make sure that that patient gets what they need. And the hospitals or the provider sites, we want to make sure that they're able to also make sure the patient gets what they need. So that's how we choose. And then once they're on board, we provide a training for them. We provide a training to our screening site that's, between 4 to 6 hours long. It could be split over time. And we also do site visits to make sure that they understand how it works. And also this program, some of it is kind of a high learning curve, but we at this office make sure that all of our sites are, very well equipped and understand what's necessary, and we're here as backup for them as well. I hope that answered your question, Pam.
And I want to just say that Travell and her counterpart, Rita, are the best in the state of Florida at helping women. They have helped me every time I've had a patient. So Travell,
Thank you, Jerry.
you are, and I need to talk to you later anyway.
Okay.
But I just pulled the budget, and actually it's really good. Even better news. They got, for the BSEP program, they got
Oh, wow.
$3,628,325 with $3 million recurring funding.
Oh,
Oh,
Oh, we could
oh, that's
screen a lot of
wonderful.
women.
Yes.
And then Casey's thing got $3 million, and then no, she got 127.5 million. 3 million is recurring for the BSEP program every year now, so that's yay.
it's
And then
recurring. That's
it
awesome.
also included 60 million for the Florida Cancer Innovation Fund.
Wow.
So we got a lot of money this year.
I
Wonderful.
knew that we got an increase, but I didn't realize it was that much. That's
Yeah.
awesome.
Yeah.
Wonderful.
Maybe they did it because the feds are cutting. I mean, they're cutting everything.
Well, we just move on. We do what we do because
Right.
usually in this and we are servants. And I always looked at us as being servants because you got to have a heart for the people to do what we do. Because I have yet to meet anyone that does what we do complain
Right.
about helping someone. We may complain about we may be a little tired, this and that, but we do not complain when it comes to trying to find services for the people in our community. And that's what it's all about. And we thank you, Travell.
Thank you so much. And
You're
I
the
know
best.
that we are very close to ending, but I want to make sure you just kind of go around the room and see if anyone has any other questions for Travell while she's here.
Anyone? Okay.
Great, Travell, that means you were thorough.
Awesome.
Great. So you will receive a follow-up email probably within the next 30 minutes or so. If you have any questions for Travell that you couldn't think about, feel free to reply to that email at any time, and we will make sure that we get that question over to Travell, and she may reach out to you. And
Great.
also, since we're talking about Florida Department of Health, the Sunshine State, we actually, you all actually have an event this coming Saturday starting at 8 a.m. at Lauderhill Mall.
That's correct.
Yes.
Correct.
So if you know anyone that lives near that area and and they meet the program requirements or you think they may, please forward that information along to them. Miss Pam, do you have anything else in closing?
Well, I also that event for Lauderhill Mall is a back to school event. So they're gonna have a lot of vendors. I had visited that event one time, and they have a lot of vendors there with resources, family resources, children resources, free backpacks. Uh, they almost have like a little mini carnival there. And so, make it a family fun. I mean, tell your friends and family, you get our newsletter. You'll get this. Terry's going to send it out. When we send you guys this information, I understand, you may say, well, it doesn't apply to me. Again, think about somebody else, and just send it to them, you can't make people go. You can't make people drink the water, but you can share it, But share that information because I'm always been a fan of if one person is saved, then we've done our job. Because you got to remember, I remember when I was that one when we started the Beautiful Gate. And look at us now, okay? So that's all I ask that you all do. Just share the information that we send out. You may not need it, but someone else will. Again, we are servants. That's it. And I thank you, Travell.
You're welcome.
Thank you.
Anytime for you guys. Anytime.
Thank you so much. And so we will see you all next month on August 28th.
Oh,
Yes, yes. And so just a heads up, we have another special guest coming. We have Dr. Haley Letter coming she's affiliated with the Mayo Clinic and also UF Health, correct, Miss Pam?
yes.
And she will discuss AI in radiology. And then in September, y'all, see, Miss Pam has already planned ahead. We have we have Miss Linda Montgomery coming to talk about disability benefits.
Social Security disability benefits. That's right.
Cancer patients. So
Yes,
yes, so we are super excited.
absolutely.
Thank you so much, and we look forward to seeing you on at one of our upcoming events. We do have quite a few coming up over the next several months.
Yes.
And if we don't see you in August, early August, we look forward to seeing you August 28th, 7
All
p.m.
right.
Thank you.
Thank you,
Thank
everyone.
you.
Thank you.
Good
Thank
night.
you,
Thank
Tina.
Thank you.
Everybody.
Bye.
Okay.
All right. Good
Bye-bye.
night.
Bye-bye.